Cross River State Health Commissioner storms remote villages to rescue severely malnourished children. As a result of the COVID-19 pandemic, which resulted in a complete lockdown of the entire world, the aftermath effect is beginning to tell on lives and livelihoods as most families, due to poverty, hunger and lack of resources, are unable to feed themselves properly or seek health care, thereby resulting in more several forms of malnutrition in communities. The Commissioner for Health, Dr. Betta Edu, has started going to remote communities with the Nutrition Task Force in continuation of the Maternal, Newborn and Children Health Week to search for these severely malnourished children as part of the monitoring and surveillance process, as our children remain a priority to the government. In a bid to address this issue of severe malnutrition in remote communities, the Cross River State government has launched a nutrition monitoring task force headed by the State Commissioner for Health, Dr. Betta Edu, whose function is to go round for monitoring and surveillance where they can identify affected children in communities. In the words of the governor, we will not only protect lives during this COVID-19 pandemic, but we must deliberately work to protect livelihood. This is a wake-up call for our development partners working in the child and nutritional health space to do more in support of government. Marasmus is a form of malnutrition that occurs when there is a low intake of nutrients and energy, thereby resulting in the child losing weight, fat and muscles. As a state, we can't remember when last we had such cases because our people readily have access to foods containing carbohydrates and protein, etc. These kids, Sylvester Ofiong and Emmanuel Sunday Akban, born on November 2018 and February 2019, respectively, never had any medical attention nor care due to lack of finances as ascertained by both mothers. The Ayade Care Insurance Scheme, which is more like a social scheme, will help this group of families access medical care free of charge. We also had Shadrach Joseph and Isaac Joseph, who are also suffering from marasmic kwashiorkor. They too have been taken to General Hospital Calabar for proper medical care and attention without any charges, and to sustain this, all the affected mothers will be provided with a running business to enable them feed their children and live a comfortable life after treatment at General Hospital Calabar is concluded. As a government, we will not allow children to die as a result of malnutrition, so the search for these precious ones continues. On their part, the mothers of the children, Mrs. Imabong Sunday and Esther Ofiong, who spoke on behalf of others, said they are all unemployed mothers. They thank the state governor, Senator Professor Ben Ayade, and the health commissioner, Dr. Betta Edu, for coming to their rescue as all hope was lost. The state government is calling on the federal government and development partners to support states with more useful health interventions and basic resources targeted at these health challenges in communities, especially as the effect of the COVID-19 lockdown is beginning to tell on our people and a lot of persons need help. Dr. Betta supported all families with bags of rice, toiletries, and cash donations as the search continues. Charles John reporting for Nanakusi TV.